This year's theme, which I mentioned, of centering and celebrating cultures in health. We're seeking to center our attention on healthier, longer lives in every community. To understand how the underlying causes of poor health affects our members of our communities and how we solve this together. Today is also many things going on simultaneously. Today is also Interprofessional Education Day, or IPE Day, here at the Medical Center, where the students in schools in every college of the Medical Center, medicine, dental medicine, nursing, and public health, come together for shared learning about the importance of teamwork between health disciplines to improve both patient care and population health. Collaboration, of course, is important in any field, but in the health professions and critically in public health, collaboration is the key to success. As demonstrated to the present in our COVID-19 pandemic, cooperation as well as collaboration between public health professionals and practitioners, clinicians, and community members and community organizations has been essential to creating the conditions to counter the COVID pandemic and to protecting people in every community. So to do this work, we have to ask ourselves lots of questions, and it's a reason, of course, to be grounded in the work of the community leaders and partners who are here. What challenges do the members of our community and communities as a whole face? Welcome, Reverend DeGraff.
Good to be.
What important work is being done, and what does the future require? And what can we here at Columbia's Mailman School of Public Health and the Medical Center broadly do to improve our contributions to your work and our community's health? So today's conversation builds on the work we're already doing and celebrating during both IPE Day and National Public Health Week. But really, I hope that this conversation will set the table for what we can do even better going forward. Joining us today are leaders of critically important community-based organizations in our Washington Heights and Inwood communities and well beyond that. In the spirit of moving to conversation, I'll give each a probably much too brief introduction as a lead-in to understanding a bit about the important work each of them and their organizations do for our community. So I'll start from your left to right with Ms. Kate Barnhart, who is the founder and executive director of New Alternatives for Homeless LGBT Youth, a longtime AIDS activist and member of ACT UP New York. Kate has worked with at-risk youth since 1994 and homeless LGBTQ+ youth since 2001. She spent 5 years as the director of Sylvia's Place, an emergency shelter for LGBTQ+ homeless youth. She now leads New Alternatives for Homeless LGBTQ+ youth, which provides a range of services to really help young people succeed in transitioning to stable adult lives. Next to her is Ms. Peggy Shepard, the co-founder and executive director of We Act for Environmental Justice. Peggy is co-chair of the White House Environmental Justice Advisory Council, chair of the New York City Environmental Justice Advisory Board, and to our joy, member of the Mailman Schools Board of Advisors. She has a long history of effective and impactful organizing and engaging of Northern Manhattan residents in community-based planning and campaigns to address and solve environmental protection and environmental health policy needs, locally and nationally, in the service of accomplishing environmental justice. We Act combines grassroots organizing, environmental advocacy, and evidence-based environmental health, community-based participatory research and solutions. We Act for Environmental Justice is dedicated to fighting environmental justice issues through citizen empowerment, lobbying, litigation, education, and community outreach. And I probably could say the same thing for every one of our leaders here. Next, to Peggy's left and your right, it's my honor to introduce Miss Rosita Romero. Well known to many of the people in the audience, Ms. Romero is the Executive Director of the Dominican Women's Development Center in our Washington Heights community. She is highly awarded community leader committed to social justice and has extensive experience, again, in the areas of community organizing, advocacy, coalition building, housing, women's issues, health, immigration, and family matters. So many of the essential pillars of what creates the opportunity for health and wellness. The Dominican Women's Development Center is the largest independent Dominican-founded organization in the U.S., which seeks to empower women and communities to advance gender equality and social justice. And to Ms. Romero's left and your right, I'm thrilled to welcome Reverend Jacques-Andre de Graaf. Reverend de Graaf, welcome. Reverend de Graaf is the New York City clergy leader of Choose Healthy Life. He is the chair of the Friends of Harlem Hospital and chair of the citywide MBE Leadership Summit. He is well known and respected for being an advocate, an effective advocate and leader for economic and social justice for communities of color, and has received, as our other panelists have, multiple awards for his activities, in his case, particularly leading the role of Black churches in addressing COVID-19. Choose Healthy Life is the historic and highly innovative Black church initiative to address public health disparities, foster resilience, and create a blueprint for wellness in our communities, in the Black community particularly, through education, advocacy, and access to healthcare resources. So it's my joy to welcome the four of you here today. Thank you for joining us. You have received many honors and awards, and we feel blessed today to have you with us. So let me turn to the goal. Our goal as a School of Public Health is to bring our work to be ever better partners to support your goals. And so I'd like to ask to just go down the line, maybe starting with Ms. Barnhart, and ask each of you to talk about the mission and goals that you and your organization are dedicated to and where you're going for the future. Kate, can I start with you?
Sure. I could probably spend a day and a half answering that question alone, but so New Alternatives is a multi-service drop-in center for LGBTQ homeless youth and young adults. We're located in Midtown Manhattan behind the Port Authority. So we get a lot of young people who are running away from red states where their identity or their sexuality is not well tolerated, and they just get off the bus right there. And now we're seeing a lot of LGBTQ migrant youth who are being bussed in from the southern border along with everyone else, but happen to be fleeing countries that don't tolerate their identity. So our mission is really to help young people, first of all, survive, and second of all, be able to move on to independent adult lives, stable lives. And we do this in a couple ways. We use a harm reduction, low barrier model. So you don't need anything to receive our services. You don't need your ID, your green card, nothing. You just show up. And harm reduction means that we can tolerate people with a wider range of challenges than some of the more traditional organizations, because we get a lot of folks with more severe behavioral and mental health challenges. And some of those folks are not able to function in a more structured setting. So, and we, provide all of our services on a walk-in basis, because folks who are on the street or otherwise in unstable situations have difficulty with appointments, and it's just frustrating for both the provider and the client. So that's the work we do. And our real goals right now, the goals we're working on addressing are really the factors that contribute to mortality in this population. So that would be AIDS, suicide, overdose, and then secondarily, a variety of diseases that will kill you without access to healthcare. So we've had young people die of diabetes, asthma, those kinds of things.
Thank you. Very work. We'll just go down the line here, and Peggy, I'd love to turn to you now.
Sure. So good morning, everyone. We Act for Environmental Justice really exists to engage the most affected people by pollution and environmental racism in the solutions. So how do we work to engage, organize, train community residents who are impacted to engage in policymaking, decision-making? How do we raise those voices and those perspectives to local, state, and federal government? And so that is what we have been doing for 35 years, our anniversary this year, because we understand how important community organizing is, assisting residents in so many campaigns, meetings, ways that they can use their training around environmental health, training around how to hold government accountable. How do we bring those people together so that they can hold their elected officials and the policymakers accountable for policies that are truly protective of their health, their well-being, their homes, and their communities? And we do that in a number of ways through community-based participatory research, which is how we began our 25-year partnership with the School of Public Health here, because they were able to help us gather and provide important data that really founded the basis of so many of our campaigns, whether it's a campaign against the Metropolitan Transit Authority to ensure that they transition every bus from dirty diesel to hybrid and now electric. We don't work as much with individuals as we do with community level issues and problems so that we can ensure that we're addressing community-wide problems. And when we do that, we find that individuals have the empowerment, the confidence, and the support, because all people really need is a little support and to know that you're there to help them. And when we're able to do that, we're finding that we can get hundreds of people through our working groups, through our membership meetings, through lobby days in Albany or at the city council. Again, it's really providing that support and that confidence for community residents who haven't received much of that from their elected officials or from community institutions. So that's some of what we do. And it's been great to do so much of it in partnership with the Mailman School.
Thank you, Peggy. It's our privilege. Rosita.
Yes, as you mentioned, the mission of the Dominican Women's Development Center is to empower all women and communities to advance gender equality and social justice. And we emphasize that we work not only with Dominican women, we work with Latina women, other nationalities, and also with men and children, with the entire family and the entire community. We are also 34 years old, so we're going to be 35 this year. We're going to be celebrating our anniversary in October. And we started in a very humble grassroots way. We passed around the hat when we had our opening meeting, and we collected $30. So we started our organizations with $30 and a dream. And nowadays we are the largest independently standing Dominican organization, have a much larger budget, of course. And we have 7 different programs. The programs that we have are the Educational Development Program, where we teach English as a second language, because that's one of the first barriers that immigrants face when they come into the country, not knowing the language. We also have an excellent, very comprehensive program against domestic violence that provides individual counseling, support groups, and we do a lot of community education and advocacy, and we are one of the co-organizers of the Brides March Against Domestic Violence. In that component, in that program, we just added a new component of economic empowerment, because one of the reasons why many women stay in abusive relationships is because of economic dependency. We also have a number of early childhood education programs. We make the connection between women's empowerment and the ability to leave their children in places that are safe, where they're going to be learning about their culture. Our programs are dual language, so they get to keep their own languages, and we teach in both languages. In that sense, we have an early Head Start program, and that is home-based, and we also have a center-based childcare center where we service 110 children. We also do a lot of health promotion, and that's where we coincide with the Mailman School of Public Health by doing advocacy, education, and prevention to try to achieve more health equity and address different health disparities in our communities. And we also have a Healthy Families program that promotes a healthy parenting. We opened the first LGBTQ homeless youth drop-in center on 179th Street. And we work with youth from 14 to 24 in that program, providing them with basic needs and recreational activities and a lot of emotional support. In terms of our future goals, we had a strategic plan last year. We are still in the process of completing it. But one of the things that we would like to do is to expand the services related to mental health, because that is a big problem in our community, especially after COVID-19 pandemic. And also plans of expand to the Bronx and other areas of the city where there are large Latino populations.
Today is the 55th anniversary of the assassination of Martin Luther King. He rose to prominence on the platform of the Black church. When AIDS invaded America, the Black community suffered greatly, and Deborah Fraser House, who's a member of Mailman's board and a colleague of Peggy Shepard's, had a vision that we needed to engage the church to organize in the community to combat ignorance. Fast forward to a few years ago, and COVID reared its head in America, and ignorance mounted the throne through a door called the internet. And we heard all kinds of rumors. They would plant a chip in your arm and they would monitor your third born, and all kinds of ignorance, but it took hold. And the consequence of that ignorance was that thousands, if not thousands of people died embracing that ignorance. And so Deborah came back. She had retired. She came back and organized something called Choose Healthy Life, based on the biblical scriptures in Deuteronomy, where Moses spoke to the people of Israel, the then people on their way to Israel, and said, before you get there, you need to choose life so that you and your seed might live. In the 21st century, Choose Healthy Life has become a movement. It's an organization that started in 5 cities, 10 churches in each city. It represented a partnership between United Way, the gold standard in philanthropy, and Quest Diagnostics. And at that time, we had a simple notion, Dean, and that was to marry faith and science. We were going to shine light in darkness so that we could live. And so in so doing, each of the cities had a clergy leader. You might be more familiar with the Atlanta leader. The cities were Detroit, Newark, DC, New York, and Atlanta. The Atlanta leader is a fellow named Reverend Raphael Warnock. I'm the New York clergy leader, and New York went on to have 20 churches. The 20 churches each has a full-time paid health navigator. And to the point that was raised a little earlier, one of the things that we provide, we have Wellness Wednesdays where people can go to their church and get information, get fed, and get things that help them combat the health disparities that exist. Because health disparities ultimately is our mission, to eradicate health disparities. We used to think that health disparities were just in one part of town, you receive this kind of service, and in another kind of town, you see that kind of service. But health disparities exist often in the mind of the caregivers. And we found that their health disparities in terms of treatment exist even in the same hospital. And so we felt that we had to mobilize and organize the church to speak out and speak up about these disparities. Last, we received from Quest Diagnostics something called the Blueprint for Wellness. And the Blueprint for Wellness is a free, emphasize free, diagnostic test based on blood, which is given to an individual, which empowers, and it's customized about what the numbers mean and what you ought to do about each individual health circumstance. And what that does is it empowers each individual to go to their doctor and say, I'm concerned about this. We're going to talk a little more further down the line about what happens when you do that, because every doctor, with all due respect, doesn't greet you with open arms when you know what you're talking about.
Thank you. So these are great. So I would love to take an extra minute or two here to ask you to, because each of you is a pretty modest person, actually, to ask you to just mention a few of the things you're most proud of your organization having accomplished. And then to reflect for a minute on what are the challenges to be confronted. Reverend DeGraff, you started a little bit on both of them. Could you amplify what you said?
Well, number one, I think one of the things that we've done, the 20 churches in New York are located across the 5 boroughs, denominational and intergenerational. And one of the things I think we are endeavoring to do, and is to make the church relevant and face the challenges of the 21st century. All houses of faith and faith walks are experiencing intergenerational decline. Somehow or another, we haven't been able to pass the baton to the next generation, and so that's a challenge. And so our churches have been able to, I think, reestablish relevance facing everyday issues for people in our communities. One thing that is an accomplishment, a milestone, or something that I would hold up is that our pastor in the Bronx, Reverend Crawford, is in the tough part of town. And he got the Blueprint for Wellness, and he went to his doctor. And guess what happened? The doctor's assistant would not permit him to see the doctor because he came in with a test that the doctor didn't order, and he wouldn't see anybody who came in with their own information. And so fortunately, he was a persistent person, and he persisted, and he got to see his doctor, and they had a successful outcome. But the look in his eye and the testimony that he gave about the power of information and the marriage of faith and science helped us to move a quantum leap forward.
So you're highlighting one of the points of our Interprofessional Education Week, which many of the students here are recognizing, which is that there are huge issues to solve in terms of healthcare equity, which you just gave a prime example of, while we solve health disparities across our communities, many of which can't just be solved in the doctor's office. Thank you. Ms. Romero, what are you most proud of, and where are the obstacles ahead?
Well, we are very proud to have remained a voice for Latina and immigrant and low-income women in our community after 34 years. Right now, we are providing services to approximately 10,000 individuals per year. And we are very proud of the advocacy that we do, advocating for the rights of women immigrants. And we are very well known for that. We also go to the marches and demonstration, and that's something that I'm very happy that we have been able to maintain that community organizing perspective within the organization. The work that we do in the different areas that are mentioned are we're proud of all of our programs. We're proud of our staff. We have here Carolina Capellan, who is the program director of our Early Head Start program. And we, in terms of challenges, some of the challenges have to do with the inequalities in funding levels. Only 2% of all private foundation money goes to organizations led by women of color. And we are subject to having to deal with government grants. 85% of the funding from the organization comes from government, which has a lot of challenges in terms of not having timely contracts, being overly monitored and scrutinized, and the lateness in contracts results into cash flow problems, sometimes even payrolls. And that has been one of the major challenges of our organization. Getting adequate space has also been a challenge. In the past, we had dreams of owning our own building and having all of our services combined in one space. And we have not been able to achieve that. We still keep it as a future goal to be able to do that. And being able to assist, because there were two other larger than us Dominican organizations created and led by the Dominican leaders. And they are under other umbrella organizations right now. Alianza Dominicana is under Catholic Charities. The Association of Progressive Dominicans is under the Acacia Network, and we have been able to remain independent, but it has been with a lot of effort, passion, time, joy, resources, and the sacrifice of many of our staff members who choose to continue to be loyal to the organization in spite of low wages, but they stay because of their commitment to the community.
Thank you so much. Ms. Shepherd.
Yeah, when I walk around the community, I think of so many projects that I'm proud of, whether it's the 125th Street, West Harlem Pierce Park, or whether it's getting all the buses off the streets from idling into environmentally, controlled depots. Those are all wonderful projects, but I think the foundation is ensuring that the agenda of environmental justice is on the agenda of the city, the state, and the federal government. And that's really a foundation. It's a foundation for the Climate Leadership Community Protection Act. It's a foundation for all of the lead poisoning prevention bills we've gotten at the city council, or the Child Safe Products Act at the state legislature, based on data and research from scientists here at the Columbia School. But the really important thing is ensuring that people's voices can be heard in the policies that make a difference to our lives. And I'm very proud of spending some time with the Biden administration to advise the administration on how to ensure that monies go to frontline communities that have been disinvested in for decades. And as you heard Rosita say, you talked about 2% of money to women of color-led organizations. 1/2 of 1% of all environmental funding in this country goes to environmental justice, community-based organizations. So again, we're really talking about having to do more with less, very few resources. Yet as a community-based organization, we're not sitting around doing nothing. We are called upon in an amazing way. Every day we're called on to, review these things about environmental justice. Tell us what you think about this. Tell us what you think about that. Join this advisory group. So we are in incredible demand with fewer resources than a lot of the other organizations that you hear about or read about every day. And the obstacles I really see right now is that we have an incredible opportunity at the federal government with the Inflation Reduction Act, with Justice 40. There are literally billions of dollars rolling into our state, into our communities. But if our elected officials, if our policymakers, if our community-based organizations are not ready for this incredible opportunity, it can be lost. So again, I go to rooms with elected officials and I ask, raise your hand if you've heard of Justice 40. No hands go up. And what does that mean? It means that 40% of all of the federal government's investments in clean energy will go to frontline communities as identified by a series of mappings that now identify frontline communities all over this country, identify them for this reinvestment. But are we ready for it? We've heard how so many of us community-based organizations have so few resources. So are we really ready for these opportunities to write grants, to meet with our electeds, to ensure that those projects that we've been thinking about and dreaming about for generations actually can happen, because there is the investment for that to happen. But we've got to step up, and all of our institutions have to step up to ensure that that money comes to our communities, that comes for public health, so that the next COVID or other outbreak is done efficiently, that our communities are protected. And so again, that is an obstacle we face. And the obstacle is business as usual. The same people being winners and the same communities being losers. That's the obstacle we face. And we've got to be prepared to stand up and raise our voices around these issues.
So I'm going to come, thank you. I want to turn to Kate in a second, but I want to come back to this point of, because the people in the audience, and we have hundreds of people online who are eager to hear how we can be contributors to your being ready and us all being ready, and actually to be able to support the goals that we need you to win on. And we need to win on together. Ms. Barnard, what are you most proud of, and where are the obstacles from where you sit?
Sure, I think there are a few things that we're really proud of. One is just, we're known as the organization in this sort of field that can work with the quote unquote difficult to reach population. And I really dislike that terminology, because if clients are difficult to reach, it's not the clients, it's how you're trying to reach them. So I'm really proud that we're able to engage and work with and gain the trust of some folks that are otherwise not connecting to services. I also think that I think we're particularly proud of our mental health services. It's very, very difficult to find mental health, especially on the psychiatric level, providers who are sort of familiar with adolescent and young adult issues and homelessness and LGBTQ issues. That intersection is really a challenge. And a lot of our young people come to us with significant mental health needs, both sort of some of the more innate, young adulthood, as most of you know, is when many things like schizophrenia start to really show themselves. But also we get a lot of people who have, through the experiences that led up to their homelessness and their homelessness, have, developed significant trauma, depression, anxiety, all of those things. And so the psychiatric needs are huge. And I think, one of the things we're really proud of is being able to get the funding together and hire a psych nurse practitioner who is a gay Black man and is able to connect with our community and really try to address some of those needs on the ground. I think we're also really proud of the fact that a significant number of our staff are from the community. They're people who have lived experience of homelessness. They're transgender people. They're people living with HIV. They're people of color. And that's, it's actually the majority of our staff right now. So I think that is something I'm really proud of. And it's something, that's sometimes an uphill battle because folks are still going through challenges. And so as an employer, you have to provide a certain amount of flexibility and support for folks so that they can develop into the best staff that they can be. I think the challenge is, I know it's already been mentioned that space is a huge thing for us. Right now, there are days when 3 of us are sharing, like literally my desk is here and then the guy working on outreach calls is using part of my desk. And then my assistant's desk is across from me. And we're all jammed into this room that used to be a storage space at the church we rent space from. So, and this church we're in has a lot of different community-based organizations renting. So we're all trying to maneuver around each other in terms of use of space. In that sense, there's a Head Start above my head, and there's like little feet running around up there all the time and stuff. So, but we manage. And then I think another obstacle is that we really, really need a shelter. When you're a drop-in, you can provide a wide range of services, but ultimately people need somewhere where they can spend the night. And there's a very limited number of beds for this population, especially once. Right now, the Department of Youth and Community Development is only funding youth shelter up to age 21. We fought with our allies, we fought a really hard political campaign to get the age raised up to 24, but DYCD has never actually funded any beds for the 21 to 24-year-olds. So those beds are all privately funded. I used to run a shelter that had 12 of those beds. And it was, it was a fight to keep them open. And there are very, very few privately funded beds for that age group. And then once you get past 24, there's only one LGBTQ shelter and they go up to 30. And then after 30, New York City, with our huge LGBTQ community, has no LGBTQ shelter that goes past, if you're over 30, you're just in the regular system. So that's a huge issue, a huge obstacle, because not only do you need the building, you also have to deal with the sort of the NIMBY issues of the politics around opening a shelter in a community. And of course, you have to deal with the funding, especially if you have a population that needs significant support. You have to be able to staff your shelter correspondingly. And funding, of course, as everyone else has said, is a major obstacle. We actually don't have any government funding at all. That was a conscious decision we made because we were trying to work with the Department of Youth and Community Development. We had a few contracts and it was so much, it was really almost counterproductive. Like the money was not enough to really justify the amount of staff time it took to manage those contracts. And then, of course, they're reimbursement-based contracts. So as a grassroots organization, you have to have the money to get reimbursed. So for us, it has made more sense to stick with private funding up until this point. But of course, that's also a lot of work in its own way. I also think, one of the problems we're really looking at right now is the increasing amount of legislation that are really attacks on especially transgender youth across the country, as their access to transgender related healthcare gets cut off in state after state. And also other, as libraries ban books with LGBT themes in the schools in different states, et cetera. What that does when the intolerance picks up in parts of the country, it drives young people to kind of, it's almost like there's a line down the middle of the country, and the folks to the east wind up in New York, and the folks to the west of that line tend to wind up in San Francisco. And so that, of course, puts a strain on the capacity in here and in San Francisco. I mean, you have smaller projects really popping up in a few places now, like Chicago now has one LGBT youth housing program like that, but it's really not enough to absorb the demand. And so we're really seeing a lot of this, young people, they get a job at McDonald's, they get $200 or $300 in their account, and they think, okay, that's enough. I can get on a bus to New York City and I'm going to get a job once I get there, and it'll all be good. And they don't realize that money is what, a day, 2 days here, and it's gone. And then they don't realize that the job market's very tight here. And then even if you work full time at minimum wage, you can't get a place to live. So they wind up homeless. And so that's the huge challenge, is just this. And the other problem is that we have a bottleneck. We have young people and all kinds of people flowing into sort of the homeless population all the time, right? They age out of foster care into homelessness. The family gets evicted. The young adults wind up homeless. They come from wherever and they wind. So this bubble is growing all the time, but there is almost no outlet. There is so little permanent housing that people can actually afford, that very few people are actually leaving homelessness. Even the city gives out all these vouchers that landlords won't take. And so all these people are just stuck in this ever expanding pool of homelessness. So that's a huge challenge for us, is sort of the fight to try to address that and create ways out for people to get out of homelessness.
Thank you. So I think I can easily speak for our audience, both here and online, to say thank you to all of you for your leadership. So important. And I think it's clear, about the synergies, the shared goals across all of your organizations, and creating the conditions for everyone to have the opportunity for health, to resolve the health disparities that Reverend DeGraff was talking about, but to also elevate everybody's opportunity for health. So I want to ask one more question before we turn to the audience, both here and online, for their questions. And I will say, for those who are here in person, we hope you'll all join us for a luncheon upstairs in our new Riverview Lounge to continue the discussion. But I'd like to, Peggy, I'd like to first go back to the point you were raising in regard to how we get ready and how we solve obstacles. And I'd like to frame it in the context of how we can work better together to do both of those things in the service of shared goals. You and I had a conversation earlier about what you imagine the role of an academic institution should be to support your work. And I wonder if you could comment on that and then help us maybe have one final round of conversation about how the School of Public Health could, and the medical center, the schools of medicine, dental medicine, and nursing together could be optimally effective partners for the goals you each are leading on.
Yeah, I think we were talking about how often prestigious universities are in very low-income communities, yet those institutions operate as an island unto themselves in a bubble, instead of being anchor institutions. An institution like a Columbia or an NYU, whatever part of the city they're in, could be providing so much support. I remember when the old days when there were school boards, and School Board 5, which comprised Harlem, was one of the lowest performing school boards in the city. Yet, the schools were literally blocks away from this enormous Columbia University, with all of its prestige, with a teacher's college. And you're wondering, well, why weren't some of the public schools adopted? Wouldn't that be a great training ground for folks at Teachers College? Or thinking about procurement and the entrepreneurs that we're trying to develop and do exist in these communities. What could the business school be doing? How could the business school be providing planning for so many community-based organizations who don't have the resources to contract with an expensive consultant? How does a school of public health really begin to develop an office of community partnerships so that the partnerships aren't with just whichever researcher sort of decides to have a partnership, and they may interact with communities in very different ways, not always at the most efficient or most equitable way. So how do we have an office of partnerships that begins to train the researchers and scientists how to really work with community, how to ask the right questions, and how to be in a space so that communities feel safe to provide the knowledge and the expertise that they have that could make all of the scientists' lives much better and enhance the research. So really, having the university really think of itself as an anchor, as a key part of the community, and maybe even talking about what are the community needs and how can different parts of that university supply that. And how do we really think about public health? Public health requires not only environmental people like me, it includes folks who are homeless and need the services, it includes women and immigrants who come to this country and need that support. And universities are well placed to provide that kind of support in a way that will only enhance the institution as well as the lives of the community folks who live nearby.
So thank you. So I'm very happy to be able to say, as Peggy well knows, that with your another partnership, and we invite all of your partnership, the school is building a novel community health equity collaborative office with the goal of meeting what you just laid out. Rosita, you look like you want to add to that. Thank you.
Yes, absolutely. Yes, I just wanted to make that in order to address health disparities, we have to continue to address the social determinants of health, which have to do with the elements of and the definition of social justice. Because we define social justice as justice in terms of the distribution of wealth, opportunity, and privileges within the society. We have in common with the Mailman School of Public Health the fact that we see health as a human right, and as such, advocate for the importance of people having the 5 determinants of her health: economic mobility, adequate education, adequate health care, adequate community networks. And one of the things that we understand is that in terms of the distribution of health in our own backyard in Washington Heights, we have that 40% of the household have a family income below the poverty level. In many of our programs, we work with families that are 200% below the poverty level. 52% of those poor households are female, and 80% are 18 years old or older. The unemployment rate in our community is 9.2% compared to 8.3% in the entire city. Out of the total 95,903 residents in Washington Heights, 48% of the population are receiving some sort of public income, some public support. And also in the United States, 1 in 5 Hispanics live below the poverty level. That's 20%. And over half of them, 56% are women. We see 1/3 of Hispanic youth under the age are 32%. We see the disparities in terms of the income for women. We have that for every dollar that a white man makes, a white woman makes 84 cents, and an African-American woman makes 63 cents, but a Latina woman only makes 54 cents. So that affects the health of Latina and Latina families as a whole. In terms of healthcare in the Latino and many immigrant communities, we have high percentages of chronic diseases like diabetes, cancer, heart disease, asthma, and HIV, obesity, high blood pressure, preterm babies, infant mortality, and COVID-19. And many individuals do not have a primary doctor. We also have the reality of the lack of health insurance coverage. Approximately 10% of Hispanics in the state of New York have no health insurance. And for the cities, even higher, is 22%. I think that one of the realities that we have dealt with in Washington Heights is the fact that we are the backyard to the large institution of Columbia University Medical Center. And one thing that we have always advocated for is that in the community, we don't want to be seen as subjects of research and investigations only. We do not want to be seen as guinea pigs. And because of that, I have joined many advisory boards. Since 2008, there was the creation of what was called the Planning Council of the Colombian Center for Health and Urban Minorities, CHUM, to promote the use of community-based participatory research. So that is something that is a very important part of the work that we do moving forward to reduce health disparities. And that calls for the involvement of community participants as members and distribution of data, ownership of data. We had in 2010 a project that was funded by the NIH and was funded and the Columbia Mailman School of Public Health with when Dr. Joyce Moonhauer was the professor. The project was called Partners in Research, and it was different in the sense that we the grant went to the 2 different institutions, as opposed to it going to Columbia University that has a 60% indirect rate and then provides a small amount to community-based organizations. We were both awarded the same amount. I was the principal investigator. I was not just a research data assistant, and we did the publication together. We owned the data together, and that is the kind of projects that we believe that should be duplicated. And of course, this was a very small grant from NIH. The university got 25,000 and we got 25, very small. And something that was interesting about that project is that we were investigating the university administration about their attitude about community-based participatory research. So we flipped the table. Instead of the university studying the community, we, the community, studied the university's attitude. So that was a very interesting experience in terms of how we are involved with the Mailman School of Public Health. Right now, we are part of the Columbia University Biobank Community Advisory. board where we are trying to increase the number of minorities and people of color that participate in the trials, so that the medicines that are developed and the research and the protocols address our particular needs. I'm also, we also have had, we have been a member of the Irving Medical Center Translational Research Project. I've been on that advisory board. We have had interns from Columbia University, School of Social Work, and also from the Mailman School of Public Health, the Applied Practice Experience. We also on the Community Advisory Board of the Columbia University Center for Children's Environmental Health with Maricela Ureño here, who has been so grateful sending us so many participants. And also we received support for some of our fundraising activities for the university. I have some specific recommendations, and since we're running out of time, I just want to read them. That we have to continue. One of them is continue to address the social determinants of health. It's not just about health; it's about how people have access to all those other material needs that will help them to be healthier. We have to continue to do the CVPR type of projects in our community. We need to understand that the community has knowledge to contribute to the conversation of how to reduce health disparities. And we believe that it would be a good idea to invite more community members to classrooms presentations and discussions. We also believe that it's important to recognize, when it comes to health, to recognize traditional remedies as ways of healing that our communities have used for generations, for thousands of years. And that is part of what we're talking about this week, celebrating culture by respecting cultural ways of healing. What do we find as well-being? Who do we go to when we feel sick? The use of promotoras de salud, community health workers, because sometimes we use these home remedies in collaboration. The doctor says, we do what the doctor says, but we also say what the grandmother says. And also, we would like to increase the number of students that participate in internships in our organization. And also, one beautiful thing that the School of Social Work is doing, and I would like to know if there is any way that you, Dean Frag is the word I'm looking for, Dean Frag that I'm looking for, is that the School of Mailman School of Public Health can do, which is that they pay for half of the tuition of our staff. We have one experience of one person that already graduated with her MSW, and she only had to pay for half of it. So it would be great if Mailman can also do the same.
This is fabulous. I recognize that we're out of time, and I'd like to ask Reverend DeGraff and Ms. Bernard to give some closing comments, and then I'd like to invite everybody here in the room to join us for a luncheon upstairs in which we can continue the discussion and hear your questions. Reverend DeGraff.
I'd like to emphasize the need for urgency. What Peggy Shepard and Rosita have both said require responses, but I need you to understand and to feel that we have come through 3 years of a nightmare in America. 1 million Americans plus have died. And in our communities, we've suffered greatly in addiction. Someone went to the hospital, and at the emergency room, they said, take an aspirin and go home, and they died at home. And someone was promised a job, or their graduation was canceled because of COVID. A wedding was postponed because of COVID, and then it never happened. We are in the aftermath of the trauma, but the trauma has not left us. And so when you deal with, when the healthcare system deals with people from our community, no matter what they're presenting, there's a backstory. And cultural competence, the watchwords that I would get from the presentations, We need you to be able to listen and respect what you're hearing and then go a little further. And so this institution, which has served so mightily, needs to be able to find and discover a way to connect to our communities and get past these walls and connect to the hearts of the people who you would seek to serve. It is not just about administering care in an instance. It's about relationship and it's about respect for our culture. We are in pain. How do I know? Suicides are up amongst teenagers in our community. The death rate, the life expectancy for Black men has declined by 3 years. It's unprecedented in the history of statistical analysis. You want to do research. 3 years, there's been a 3-year decline in our life expectancy. Divorces are up, alcoholism is up, gun violence is up. These are the manifestations of the post-traumatic period that we're living in. We need you to, whatever your discipline is, whatever your goals are, we need you to find a way to connect to the people and the issues that you're being presented today. And when you're an intern, you go into an institution or a facility to learn and then you go back. We need you to bring something to the table. We need you to connect and be determined to come, and the word outcomes is so important. We need to change outcomes. There should be a difference in Washington Heights because Columbia is here than there is across the river in the South Bronx. And so I would give you today, I would close on this day, the anniversary of Dr. King's death, who I met as a teenager and planted a flame in my heart that burns to this day. Each person under the sound of my voice would make a dedicate themselves to making a difference, not just by your degree, not by what you major in, but making a difference so that you could answer the question, what did I do that I was proud?
Thank you. Kate, I'll give you the last word, Ms. Barnhart.
Okay,
And then we'll actually not adjourn, but travel in a progressive way up 2 flights of stairs or the elevator to continue the conversation together. Thank you.
okay, so that's a hard one to follow, but the I think what was touched on about the idea of getting beyond the walls is really essential. Like what we've found is that if I say, say to a client, okay, go over here and you can get this service to someplace that they've never been before and they don't know if it's going to be accepting to them. And they just, a lot of the time, they just don't get there. And we find that what's worked for us in terms of public health initiatives, like for instance, addressing monkeypox, which, clearly our population was at increased risk, was when the monkeypox vaccine came to us and we gave them a spot in the library and the clients could go in there because they felt safe in our space. And so when we said to them, hey, it's important to have this vaccine and they could do it where they felt safe, then they did it. But if they had sent them off to some, bureaucratic institution where they had to bring this document that they couldn't find and register and read papers they couldn't read and whatnot, it would not have happened. And so I think it's really important to, as you think about serving these communities, to think about really like get out there into the communities where people feel safe and feel like they belong and provide the services and whatever reasons you have there and not make people sort of penetrate these institutions that can be intimidating.
So I cannot thank the 4 of you enough. I'm probably obviously quite moved by what you each said, but also deeply appreciative of the charge that you're giving us, because we have spent, coming out of this pandemic ourselves, a lot of time thinking about with shared goals, the fact that we have not together solved the problems that still confront us and increasingly confront us. And we want to figure out and accept your invitation to step up to do our part in ways that matter more than ever. So I invite and hope that all of you will join us upstairs to have a real discussion that builds from this. And I thank you for your generosity in what you've told us in coming today and for your great leadership. Thank you.